as you guys have both touched on, technology and equipment. From your perspective, Emmanuel, maybe we'll stick with you. From your perspective, when you are evaluating your language services partner or program, um, how are you evaluating that? Like, what metrics are you holding them accountable to? And what are some of the areas that maybe we should be thinking about as a language services provider that we're not today?
Yeah, and Corey, that's an interesting question because we just went through an evaluation
Sure.
of our vendors from an LSP standpoint. So I would say gone are the days where and I'm going to just say this from a standpoint of high volume of clients, if you could put it that way. Gone are the days where we just focus on um, the cost per minute as a single metric. I think what I'm looking for from a vendor is a couple of things. Cost is one thing, but ultimately, at the end of the day, I look at it and I look and say, is a vendor bringing quality? And I'm talking about just not quality of equipment alone, but quality overall of their consulting, quality of the product profile. So, is their portfolio well-rounded, meaning that they own the full suite of their portfolio, and when they're bringing it in, it seems like it's stitched so together. This is Airman's portfolio. This is so and so's portfolio, and it doesn't feel like they're outsourcing so much that I'm not even sure who I'm buying it from. Do they have a working relationship in understanding my business, healthcare? Do they have a very good network of interpreters across the board that actually can service me at the end of the day? And then, further than that, I also look and I'm looking for somebody who is actually speaking about those things to me that most vendors don't speak to me about. What is happening in the market?
Hmm.
Start strategizing with me about things that most people are actually not doing today, and help me understand around, hey, this is what's happening legislatively, this is what's happening, X, Y, and Z. Let's start putting a strategy together. That vendor, that LSP, is gonna probably outshine beyond the cost, because you could offer me the best cost, and the opposite of it is your quality is pretty terrible. And I know there are quite a few of us listening to this call today who have gone down that road where you're getting a really good price, but you're suffering right now because you're struggling from a quality standpoint. I can tell you on the other end, there are people who have actually who are paying, who are getting a good rate, but are getting a really good service from the LSP because they understand the business, they understand the balance of it. And so at the end of the day, I think as a business owner, it's important for us to not chase the rate at the end of the day. That's a really good thing to do. And sometimes it gets people promoted, but at the long time, in the long run, look at the total value of the package that the vendor is bringing to the table. And that's what made it easy for me to be able to come to the table and say, this is the vendor that we're going to go with.
Yeah. Wow. Very, very helpful. Neil, what about you?
Yeah, and I think I really love the dichotomy just because Emmanuel's looking at everything from the enterprise level,
Sure.
while also focused on, local hospitals and local areas. And then I've got, just local looking at things. So obviously, there's the basic metrics of, speed to connect, reliability, ease of use, language availability. Those are definitely things you want to look at just because they're necessary. But also, does the LSP understand the community, the demographics, kind of the woes, the obstacles of, the specific hospital, the specific layout? Are they going to come on site and help you work through those and mitigate and push out different initiatives? AI is really big, so are they going to be on the forefront of technology and innovation? Are there going to be things that maybe are, not tangible an asset, but make it, completely different experience for the patient? As Emmanuel alluded to, quality and patient experience, I think, is going to be the gateway through 2026 into 2027. And that's really what we're focused on. So partnering with someone who's going to be available to help us improve those metrics, give us the data and analytics, but then also help us get to that next level, I think is really important when you're evaluating an LSP.
Yeah, that's a good call. And I'm curious, you touched on the metrics piece. Do you mind digging in a little bit more, like when you're looking at metrics and you're looking at some of the things that you're measuring your language service provider at? We all know average speed to answer, call duration. What are some other metrics maybe that we should be thinking about as an industry outside of those two core, right? We touched on cost per minute as well.
Yeah, so I mean, for us, focusing on the emergency department again, one of the biggest things when we were kind of doing a full walkthrough was our walkout rate.
Yeah.
At the time, in the beginning of 2024, our walkout rate was about 10%. So, 18 months ago at 10%. And so it was a complete walkthrough of where the delays were, what was causing the issues. And, adding interpreter devices into the rooms was just a small part of the broader scope that really helped to alleviate some of those delays. Now we've brought our walkout rate down to about 1.4%. So if you're looking at that in tangible numbers, it's 770, almost 800 patients a quarter that we're now able to care for, keep within Metro West Medical Center, that aren't deferring care till they're really sick or getting care somewhere else. And so, partnering with a really good LSP to make sure that they're not looking at, just those basic KPIs, that there's, the overall broad initiatives of the hospital and where they think they can work into to help, alleviate some of the pressure, I think is really important. And that's been really successful for us. Advanced triage protocols, those go a long way. And bringing our median length of stay down from 244 minutes down to now we're at 171 with a goal of just under 170, which we're working to get to by the middle of June. So when it comes down to it, it's just a few minutes that can really make the difference for patients. And so providers, clinical access teams not having to run out into the hall to find an available machine and is it plugged in, is it going to be charged, has made a huge difference for us.
Yeah. Emmanuel, I'm curious from your perspective, like probably very similar maybe metrics that you advocate might be measuring. Are you seeing the same in your eyes? And are you seeing stakeholder input on internal stakeholder input on measurements that LSPs are being held to?
Yes, so I'll break it down to what we're holding LSPs to and then what we're holding ourselves internally to. And
Great.
I'll start with what we're holding ourselves internally to. So we look at patient experience data, and there's specific data that we look at that says, and it's pretty interesting. When we look at LEP patients, LEP and deaf and hard of hearing patients, our data says they actually this is the likelihood to recommend. They'd recommend us higher than our English speaking patients. But when we look at two questions, listen to me and help me understand, we are actually on the negative on that. So we have some work to do, which tells us very clearly, and we can look at it actually by language. So we dissect this to a language level, and it becomes very clear that we have a lot of work to do with LEPs and deaf and hard of hearing patients in terms of listening to them and helping them understand. And that's work where we partner with our clinical teams to say we can do specific action items with language to be able to move that needle and get it back to our English benchmark. And by the way, if we do that, a likelihood to recommend on that one will actually shoot way beyond it. And that's a beautiful statement to be able to do. So internally, we have that work we're doing. In terms of how we hold our LSP accountable beyond average speed to answer, which is a critical thing, one of the things we are looking at is our longest calling queue per language. So longest call in queue for language is not the average anymore, is how long did the longest call last? And we then have a conversation around it. Is it an LLD? Is it is it one of our top 15 languages? And if it's one of our top 15 languages, let's have a larger discussion of, is it a one-time scenario or is it a continuous conversation? And that comes down to a partnership then with our LSP to be able to say, how do we feel this language long term, or how do we address it overall? But longest call in queue is a critical one. And then the other piece is around our interpreter quality, which is what I call an Uber score from the end user that says, hey, this interpreter did this scored this way based on how I felt the session went. We look at those scores and the ratings and provide that feedback at the end of the day to say, how are we generally doing, and are we seeing a drop, or are we doing pretty well? That's essentially it for the most part. Providers, all they really care at the end of the day is was my call answered and was it answered quickly? And if it was answered quickly, they move on.
Yeah, do you find with the scoring mechanism that you've got in place, is there a certain trigger that if it's less than fill in the blank, that there's immediate follow-up, and maybe some areas around quality and improvement around that aspect?
Yeah, typically when there's dissatisfaction, that's when they will go
Sure.
and enter it in, which becomes an easier way for us to actually be able to know where to act. For the most part, if it's good work, it defaults to a 5, and we move on from there. But what we've also found is that when the interpretation went very well, they will actually stop and provide feedback. So it's not just bad, it's not just constructive feedback that they're providing. They also go in and provide great feedback when the session went well. And those two things are feedback that goes back to the interpreter, but it's important for us to be able to look at it and construct. That's quality feedback, and then the other one is all about the quantity. How quick were we in answering it, and we look at both of them and just understand, can we do well with that and not or not? Is it a weekend thing? All those things are things that you have to analyze with looking over time. The good thing around it is I feel like we've progressed well, but you still have to look at that one or two complaints that come through.
Sure. Yeah, that's helpful.